A trending topic on international social media at the moment is people from different countries traveling to China to experience its medical services. Many have been shocked by the efficiency and affordability of treatment in China and have started to ask about the reasons behind it. Life expectancy in China has risen from 35 in 1949 to 79 in 2024. So how did China turn a blueprint into well-being for every citizen? Where are international students choosing to study medicine in China? And how can we build a community with health equity for all mankind? This year marks the 105th anniversary of the Communist Party of China. And today, we discuss the wisdom of governance behind China's achievements in healthcare. So first, please allow me to introduce the guests joining me today in the studio. First is Dr. Ying Jiaoqian, Deputy Head of the Civil Aviation General Hospital. Welcome.
Thank you.
Our next guest is Emma from Cape Verde. She is an undergraduate student of the Peking University Health Science Center. Welcome, Emma.
Thank you.
My next guest is Mokshada from Nepal. Yeah. He's also an undergraduate student at the Peking University Health Science Center. And both Emma and Mokshada are intern doctors at the Civil Aviation General Hospital. So welcome you all. And we also have a guest joining us online, Visar Jafari from North Macedonia. He is a surgeon and he used to both work and study in China. Thanks for joining us online.
Thanks, welcome. Nice to meet you, nice to hear you. Big great things to Beijing.
Thank you. I'm so glad that you're all here to share your experience here. So first, I have a question for all of you, all four of you. Can each of you use one word or maybe one short phrase to describe how you feel about China's healthcare? Maybe start with the doctor.
Yes. If I had to choose one word, I would say once. Over the past 105 years, China's healthcare has changed profoundly. It has moved from simply making medical care available to make it more affordable or higher quality and more comfortable for patients. People's health has truly placed at the center, I think.
Thank you. Emma, what word or short phrase would you use to describe?
Dependable, because I think the Chinese medical healthcare is very high-tiered, and the system also is very nice and let people feel very welcoming when they come to the hospital.
Thank you. Mokshada, what about you?
I would say commitment. I've seen this in surgeons working at midnight. I've seen this in teams discussing a particularly challenging case long after the meeting was supposed to end. And I've seen this in researchers working for years for an answer that might one day help someone they've never met. So not perfect, but perfectly committed.
Thank you. Visar, what about you? What word or short phrase would you use to describe China's healthcare?
Maybe I can use a lot of words, but I will choose just some of them. It's well improved, well organized, and the patient is in the middle, in the center of all of it, because we are talking about a population of 1.4 billion people. So this is amazing.
I think your answer also shows that the CPC really put people's health at a really strategic priority position. As we saw in the past decades, Chinese people's life expectancy grow dramatically. Yes. So, Dr. Ying, can you tell us what's your take on this dramatic change? What's your take on China's healthcare system?
Okay, I think these concrete medical benefits come from three strengths working together: institutional design, a well-connected healthcare, and a modern governance. First, at the institution level, the government takes the lead and keeps public welfare at the core. More than 95% of China's 1.33 billion residents are covered by medical insurance. Centralized bulk procurement has cut the prices of more commonly used and chronic disease medicines by more than half, easing the financial burden on patients and avoid the higher costs on these people. Second, the healthcare network connects cities and rural peoples through a three-tier service system. In many places, residents can't reach the medical services. Most primary of them, long-term prescriptions and full chronic diseases are accessible and affordable for medicines. They can be treated to home, while serious conditions are backed by higher level conditions. Third, modern governance has made hospitals more efficient, standardized procedures, digital management, insurance reforms, and smoother patient flows have all improved public hospital operations. Online consultation and on-site reimbursement are becoming increasingly common. Okay.
So I have a question for all three of you, our international doctors. So during your exchange at a Chinese hospital, was there a moment that made you think, wow, this is quite different? It can be something surprising, shocking, or heartwarming.
For me, two things come the most is like how doctors, they come together in emergency situation and show their expertise and treat the patient illness like very fast. And then the second one is how here in China they mix the Western and traditional Chinese medicine together.
Mokshada, what about you?
This is part of a research group I'm a part of. And that day we had a multi-specialty meeting. So we were doctors, researchers, and we even had a family member from a patient who was suffering from malignant glioma. And we were halfway done through the meeting when this family member, he stood up, he made a deep bow, and he was like, I know my wife's malignancy is in a very difficult situation, but 两害相权取其轻, choose the lesser devil. So please do everything you can and push every boundaries you can push and see where this thing can go. And this moment really stayed with me because before that, research to me was papers, protocols, data. But that moment taught me that behind every medical case we see is a real person, is a loving family, and is a hope that refuses to die.
I think one common thing that among all the answers that you gave us is the efficiency. Yes. So I think especially when you go to a big major hospital in China, chief physician's half-day patient load could be as worth as like a same amount of, say, a chief physician's in other countries a week worth, right? So, but at the same time, we notice the process of people getting treatment has continuously been optimized and make it more accessible for average person in China. So, Dr. Ying, can you share with us why this efficiency is so crucial for doctors and patients, and what are the challenges?
I have felt this so-called Chinese efficiency very deeply. For patients, the biggest benefit is easier access to care and resources. High-quality specialists are more reachable, and patients do not have to wait as long or travel as far, which greatly reduces both time costs and barriers to treatment. At the same time, But the challenges are very real because heavy workloads bring intense physical and mental pressure, as well as a high risk of burnout. High patient volume also raises the bar for clinical standards, quality control, safety management, and risk prevention. Overall, this is a necessary choice under China's national conditions. So, efficiency, quality, safety, and compassion can develop together.
Was there a moment between doctor and a patient that really moved you? It can be a story, a small detail, or some words. Just the moment that really touched you.
The first one is like how doctors, even after the patient's discharged, they give the patient their WeChat for accompanying the patient even after these, like to see if the patient is okay. And if the patient have something to ask, for example, with taking medicine, for example, they can just text them and ask, and they're so happy to reply to them. Because in my country we don't have it, like if you finish see a doctor, you're discharged, after that it's finished. If you have a problem, you come to the hospital again, and that's it. And another one is like, there's some occasion that the patient is very angry, and the doctors are so patient. They don't get mad whatever the patient says. They just very patiently goes and talk to the patient or the patient family to calm them out. For me, that one was like so impressive. And another one is like after the patient is okay, they will come back, bring a doctor's gift, like fruits, for example, or something to drink, and thank the doctors for their jobs. And for me, I would say, wow, this is very amazing, because I realized that doctors here, they work really hard. And after seeing the patient come back and thank them for that, I feel like that's truly amazing. Yeah, for me, this three.
Visar, was there any moment that between doctor and patient that really touched you as well?
Yes, there are many moments, because I have been in fellowship in China for 2 years. The patient, they are always very thankful, and they respect their doctors very much. This is very important about the doctors. There was one family case. The man, there were a wife and a husband, and the husband had esophageal cancer. Both of them were retired, they were in age, and the patient had 3 or 4 weeks he was in the hospital. First, he had the operation, and after the operation, there was some complication that because he was in age and he had some other comorbidities, and he stayed in the hospital 3 weeks more. And I saw every day when we were going in the outpatient, in the visit to the patients, his wife was very worried about her husband. And after everything finished, she just said one sentence to the doctor, to the professor: "You saved my life." And the professor asked him, "Why your life?" She said, "Because my husband is my life. I don't have anyone in this world. I have just him. You saved him, you saved me." So this is for me, was something that I cannot forget, what happened in Beijing, in that hospital, in camps. So I think this is very good to feel and to see and to be present there.
Dr. Ying, can you share with us some project or maybe system reforms that led by CPC party members that ultimately improved patients' experience or maybe improved the clinical flow?
At Civil Aviation General Hospital, we have always used party building to drive clinical work. One concrete example is the MMM case review system. MMM system stands on for morbidity and modality. And the system focuses on reviewing cases involving complications and deaths. In the past, departments reviewed cases separately, so shared workflow gaps and safety risks were easy to miss. So party member leaders and senior clinicians took the initiative to take this difficult work. They were willing to put the hardest cases on the table first, examining their own shortcomings frankly.
Okay. Emma, I'm wondering, during your exchange in Chinese hospitals, is there any, say, healthcare policies or healthcare service that you really hope that one day you can see it in your own country, and why?
I think the one that I would choose to bring to my country would be the online system. So if you have something to do, you just go do your stuff and you know when you have to go. You don't need to stay in the hospital for, 2 hours waiting,
Yeah.
For me, I think this one is amazing.
So my country, Nepal, we have different geography, different resources. So maybe we can't, or maybe we even shouldn't copy the Chinese model exact. But what I think is universal is we should create an environment that's conducive for the providers, doctors, and the patients, maybe conducive for the providers to give the best care and patients to access that care. In China, that's made possible through several ways. One example is how everything is so connected and intuitive. And another thing is this culture of working together. We do have cross-departmental meetings where surgeons, internists, researchers, students, nurses, and engineers, we sit down together, we think of solutions to an idea, we challenge each other's views, and overall try to find the best way forward for this patient. So in China, there's another saying, 功成不必在我，功成必定由我. Success may not be dependent on me, but I should be part of it regardless. And I think this is a culture I would like to bring back to my country.
Dr. Ying, in the past decade, we noticed dramatic improvement in the healthcare system in China. For example, wider medical insurance coverage, lower medicine prices, and cross-region billing. I'm wondering, is there any example of a disease that used to be incurable, but now is curable, and how that changed patients' life?
Many special drugs for rare or difficult to discuss disease, as well as imported medicines, were extremely expensive and not covered by medical insurance. So, putting life-saving treatment out of reach for ordinary people. But in just a decade, the situation has changed dramatically. With expanded national medical insurance, centralized drug procurement, and zero tariffs on anti-cancer drugs, once unaffordable life-saving medicine have fallen sharply in price. Today, Imatini can cost as little as just over 800 yuan. After reimbursement, patients may pay only around 1,000 yuan out of pocket per year. So these tangible improvements have truly benefited ordinary people.
I can share with you all a quite impressive number. For example, in 2025, there are 1.28 million foreign patients came to China for treatment. And that's up nearly 3/4 compared to 3 years ago. It's quite an impressive number. I'm wondering, from your perspective, what attracts them to come to China? What are the reasons? Maybe start with you, Emma?
For me, I think it's the price. If the first one is the price of the healthcare here in China is very effective, and also here they have the tiered medical system. It's very nice, especially for surgery and oncology. And the patient come here and they are treated very cheap. You can say very cheap, but compared to other countries, is very cost effective. And also they come here, they can be healthy, and also they can appreciate the Chinese history, because here in China there's very nice history that you can come and see. So they just combine one thing to another, come for the health, and also why not enjoy the tourism together, you know.
Yeah, I would like to frame it as a question. What will make people go to a distant country and have their illness taken care of? I think this can be many reasons. One, international rankings or advertisements, but at the end of the day, I think more often than not, it's about the trust that you will be seriously taken care of. And this again often comes from hearing stories of other people being respected and seriously taken care of. So I think hearing it from people around you, these stories of successful operations or warm treatment by nurses, all of these little factors add up, and when you hear it from people around you, it will motivate you to come to China.
Yeah, Dr. Ying. So this number of international patients coming to China shows China's openness, and it's also very impressive. China is able to balance the openness and order with international patients coming to China to get treatment, but without using public insurance funds. So, what do you think of this model?
The growing number of overseas patients choosing China is not accidental, I think. It reflects the overall strength of the Chinese healthcare system. The key lies in sound systems and refined management, government-led, public welfare-oriented policies, tiered care, universal medical insurance, and centralized procurement have helped strike a strong balance between efficiency, fairness, and cost. So within hospitals, standardized quality control and digital tools have also made care more efficient, accessible, and affordable. This benefits both China and the wide world.
Civil Aviation General Hospital has trained medical students from over 40 countries, as we are meeting these two wonderful students from Nepal, from Cape Verde. So what kind of mutual learning does this international training create?
This kind of international medical education cooperation is about mutual empowerment, I think, shared learning, and close people-to-people ties. For China, first, it pushes our hospital to keep improving teaching and management, to train students from different countries. Our courses, world rounds, clinical standards, English language teaching, and cross-cultural communication all need to move close to international benchmarks, I think. This raises the overall level of the hospital. Second, it broadens our perspective and encourages diversity. Students from different countries bring different media and clinical ways of thinking. They help us, doctors, teachers, and the students move beyond a difference and embrace diversity. For international students, they learn much more than medical techniques. They also take home valuable Chinese experience, including our efficient diagnosis and treatment system, tiered management, the integration of Chinese and Western medicine, public health emergency response, and patient-centered service. These are practical methods they can apply after returning home and use to benefit people in their own countries. At a deep level,
I'm wondering, are you optimistic about the prospect of global healthcare and why? Maybe this time I can start with you.
Sure. I am very optimistic. I think by 2035, healthcare will be more preventive, treatment will be more personalized, and we will see more and more integration of technologies, including AI, in clinical decision making and others. But that being said, technology always advances. It has always been so. But the real question will be if this advancement in technology, we can channel it to the right way, which is to reduce patient suffering. And that's a very simple goal and almost the only goal we have in healthcare. Be it today or in 2035, if we can do that, then it will be a successful healthcare model.
Visar, joining us online, what's your take on the future of the global healthcare?
From my point of view, my country, for example, is in Europe, and we are following with our Ministry of Health the issues of the, if I can say, the West world healthcare. I think that if my country wants to share the best experience in this way, they should find a solution for following the both sides of the world, meaning how they advance and how they improve in this fields. So they should have, for example, collaboration with China about the annual meetings of the healthcare every year, so they can find the points that they can improve themselves. And of course, any other country that they think they can have efficiency in seeing their progress, my country should make this kind of steps so they can follow the improvements of the best healthcares in the world. I think also the safety in China is very important. We see China now in the world has developed in many fields. This also attracts also the patients for China. The people are seeing the statistics and they are seeing the volume and they are seeing the treatments. And this is why they come to China about the treatment, because it's all about the numbers from my point of view, especially in surgery.
All the stories that you shared, the perspective you shared, shows us the impressive improvement in healthcare in China. Of course, that improved, dramatically changed Chinese people's life. But what's more impressive, what's more shocking in a positive way is you all are now using the knowledge and experience you have observed and learned in China and trying to help improve the healthcare system in your own country in many parts of the world, because we are trying to build a community with a shared future for all mankind. That in order to achieve that goal, we have to do so many things: reduce poverty, to remove discrimination, improve economy and material reality for people around the world. But you're doing your part, improving healthcare to bring health equity for all mankind. That is so crucial in order to build a community with a shared future for all mankind. So thank you so much for sharing your stories, and I really hope that one day we can all achieve the goal, health equity for all.
Thank you for having us here.
Thank you. Thank you.
Thank you.